Morning. We are here today talking about the very important topic, not always the sexiest topic, but very important topic of health insurance. It's that time of year with open enrollment happening. We'll get into all of the deadlines and timelines and all the things you need to know with our good friends from Priority Health. So today I am joined by Miranda Potts and Omaira Mejias. Hopefully I said that right. They're both enrollment specialists at Priority Health, and they are personally, this is a personal interview for me because I use Priority Health. I am a proud member, and these two both help me. Not so much a daily basis, but whenever I need, I know I have them a phone call away. And so this is something we are honored to partner with Priority Health. We are living the messaging here. But we're going to dive into this, and I'm going to let them introduce to you a little bit about who Priority Health is. So thank you, ladies, for not only helping me and my family. We were just talking before this about my son has a wart on the bottom of his foot and we need a dermatology appointment. And I said, hey, we don't need referrals, right? And they just confirmed that. We'll get to that, but that is one of the big selling points as a busy mom, not needing a referral. But seriously, you guys have helped me so much in the last year of me coming over to Priority Health, and I'm so grateful for it. And I know that you, throughout this interview and this conversation, you're going to help a lot of other families in Metro Detroit as well.
Absolutely. Yes, definitely.
Yeah. So tell us a little bit about Priority Health.
So Priority Health is a nationally recognized nonprofit health plan based in Michigan, and we are more than just a health plan. We're your friends and neighbors. Our main office is in the heart of West Michigan, and with over 30 years of experience, Priority Health is the second largest health plan in Michigan, serving over 1.3 million members each year. Our network does include hospitals like Corewell Health, William Beaumont University, Trinity Health, Henry Ford, and U of M. Now, on the east side of the state, you may have seen our free outdoor fitness courts across Metro Detroit. Our newest one is at Daly Park in Dearborn Heights. It's part of our 24 fitness courts throughout Michigan. Now, these courts do offer a full body workout with no weight required.
Yeah, those are awesome. We have highlighted those on LittleGuide. And we have an outline of all of the locations in Southeast Michigan. So check that out. We'll post that as well. And I think those are incredible. You guys do a lot of incredible work in the community, and we can touch on that later. But I think that's one of the things I love is, one, you truly are our neighbors. You are from Michigan. You are here. I call you. You're the same time zone. You are also moms going through the same thing. You're like, my son had a wart too. And you're like,
Yeah.
this is what moms do and talk about, but you're here to help. And again, I see that firsthand. So now personally, yes, I have an individual health plan. So can you talk a little bit about that and who uses it, benefits from it, et cetera?
Yeah, absolutely. So yes, people call it an individual health plan. Some people call it private insurance, so it can be known as either or. An individual health plan is for anybody under the age of 65 who cannot get coverage through an employer, Medicaid, or Medicare. So some people who use these types of plans would be those who are entrepreneurs, freelancers, do gig work, they're between jobs, planning to retire early, or those who are just simply not offered health coverage with their employer. This is the option for you then.
Yeah.
Mhm.
And obviously I have a family. So what makes Priority Health a good choice for families?
That's a great question. So here at Priority Health, they are dedicated to providing comprehensive, high-quality healthcare coverage that meets the unique requirements and needs of families. So we offer a wide range of plans with benefits designed to support the health and well-being of every family member, from infants to adults. Now, with our extensive network of healthcare providers, that ensures that you have access to top-notch care when and where it's needed.
Yeah. Obviously families, kids, very expensive. How are some of the ways that we can solve or save money through Priority Health?
Yeah, absolutely. So that's a good question. There's a couple different ways. So families can save on health coverage two different ways. There's an advanced premium tax credit and also cost share reductions. I'm going to just talk about both of those. But did you know that four out of five families in Michigan can get a health plan for $10 a month or less, depending on their income? This is thanks to the government subsidies. Again, the advanced premium tax credit, it can help lower your health plan premium. Even a family of four earning up to $124,800 a year can qualify for this subsidy. The second subsidy that you can potentially qualify for, which is a great option, is the cost share reduction, also known as CSRs to some. It's available through the marketplace as well. This benefit applies to silver tiered plans through the marketplace and helps to reduce deductibles, your out-of-pocket max, copays, coinsurance, and then essentially making your healthcare more affordable.
Yeah, lots of different, I mean, you mentioned silver. Can you talk a little bit about the plan types and, where you can help save on health coverage?
One thing I also wanted to mention is that if you're not eligible for the tax credit through the marketplace, you can still save on your premium by shopping off marketplace direct through Priority Health. And then also members have access to cost saving tools like our cost estimator and Price My Meds, so they can find the most affordable options for their healthcare needs.
And then as far as plan types, Priority Health does offer a range of affordable plans to meet our various needs, from silver plans to travel plans. Now, the silver plan, it provides a balance between coverage and cost. Ideal for managing chronic conditions with affordable deductibles and co-payments for specialist office visits, lab work, and medications. Our narrow network plans do allow members to save on premiums with a smaller network of providers, including doctors, hospitals, labs, and outpatient facilities. Now, for example, our Southeast Michigan network covers Corewell Health, Southeast Michigan, and Trinity East providers. We do also offer health savings account plans, often referred to as an HSA plan, and they're great options if you tend to be healthy and prioritize savings. Now, these plans offer you protection in case of a major health event, and it allows you to save for medical expenses with a health savings account. Now, with an HSA, you can take advantage of federal tax benefits and roll over any unused funds into the next year. Where with our travel plans, they include coverage for physician visits outside of Michigan at the same cost as in state. So it's ensuring that you have access to medical care wherever you are. An enrollment specialist can definitely guide you through the process to help you find the best plan for healthcare, for your healthcare need and lifestyle.
Is the travel a year-round thing that you include in your package, or is that something like I know I'm going on a trip and it's like an add-on?
So it's actually a plan. So the travel plan is a specific plan that a member can get. So there's two options. We have a standard bronze plan, and then we have our standard silver travel plan. So they're both travel plans, the only two travel plans that we do offer, and it allows you to see providers outside of the state of Michigan who participate with our Cigna partner.
Yeah, it's good for the traveling nurses, over-the-road truck drivers, snowbirds who are going to Arizona and Florida. So when they're traveling, it is perfect plan for them.
That makes sense. Okay. See, we gotta ask these questions. But talk about local and the large network of specialists and hospitals. Can you talk a little bit about your access to those providers?
Absolutely. We have a very broad network here in Michigan. Priority Health has top hospitals and specialists that are participating with the plans. We also provide virtual, urgent, and primary care options. So you can get care when and where you need it. You can download the app and do that virtual care as well. Our Find a Doctor tool helps you locate those preferred providers within your specific network. Priority health plans ensure that you have access to all high quality care wherever you are.
Yeah, love that. Okay, so obviously we have a lot of moms and expecting moms on LittleGuide that follow along. Are there any programs or resources specific to new or expecting moms? Parents?
Definitely. So Priority Health loves moms. So we offer programs like Priority Mom, which provides educational material and services to support moms during pregnancy. Now, we also have a program because we love babies too. We have a program that's called Priority Baby, which it supports children and their caregivers during the child's first 2 years with healthcare information, gifts, and incentives.
Love that. Okay, well, and so the graduation to that is that you have these babies, and then, as any new mom knows, you just have these regular routine checkups that you need to hit. Can you tell us a little bit about the coverage options for those routine checkups, vaccinations, all the things needed for, when you have those babies and you're in the doctor's office every couple weeks?
Yeah, absolutely. Those well child visits are very, very important when you come home. So Priority Health plans do cover routine checkups and vaccinations as part of the preventative care benefits, both for parents and children. These services, again, they're essential for monitoring your child's growth and development and protecting them from preventable diseases. Regular checkups and vaccinations, they are covered at no additional cost to you.
Nice. What about emergency care for children?
So Priority Health covers emergency care for children, ensuring that they do receive necessary medical attention in urgent situations. Our plans include access to a wide range of emergency care providers, so you can rest assured that your child will receive prompt and effective treatment when needed.
And of course, we never want to think about it, but if a child or an adult has chronic conditions, how can you guys help address those within families?
That's a good question. So our chronic condition management program that we have, it includes extra coverage for diabetes, high blood pressure, heart disease, asthma, depression, and anxiety. We understand how important this entire topic is. There is 60% of Michiganders living with a chronic condition. And here at Priority Health, we are dedicated to reducing that number. So our plans offer comprehensive coverage for managing those chronic conditions in both adults and children. The My Priority individual members, they get access to medications and services before deductible to help control their condition. So they're, paying a copay or just a percentage of what they're needing.
Love that. I know earlier you had talked about the virtual urgent care online through the app. Can you talk about some of those benefits and some of the perks that Priority members offer or receive?
Definitely. Who doesn't love the perks? So as a value Priority Health member, you'll enjoy several added benefits, all accessible through your member portal. We have access to virtual care, including $0 virtual urgent care, on-demand mental health support, and our Find a Doctor tool. And it helps to ensure that you're getting your preferred providers that are in network. Now, we offer ways to save and keep costs down with our cost estimator, our low prescription copayments, discounts on hearing aids and exams, and Price My Meds, which automatically applies discounts to lower prescription prices. Now, to help you stay healthy, we also do provide global emergency assistance, a well-being hub, our benefit hub, and our affordable active and gym memberships.
Love that. Obviously, we're doing this in a timely manner because their deadlines are quickly approaching. One already passed, so this is the final deadline. Can you talk a little bit about the deadlines, when to enroll, how to enroll? But yes, this looming deadline of January 15th, which is next week. What is it, next Wednesday?
Wednesday.
You guys have been working on this deadline, but yeah, why these deadlines matter, what it means. And I would also love for you to touch on you know, obviously we have a hard deadline here, but again, going back to the new moms, new family members, life events, that actually can help you throughout the year too. I mean, obviously that category is a categorized, benefit of having, you know, getting an additional add-on or
Yeah.
whatever.
The special enrollment period.
Yes,
Mhm.
thank you. See,
Yeah.
special enrollment. See, I
No.
kind of know this stuff with the verbiage. So yes, let's talk about deadlines and all year round, how if you have a life change, how that affects you.
Yeah, like you mentioned, the deadline is really important. So it's January 15th is the last day to enroll in coverage during the open enrollment period. The open enrollment period starts November 1st through January 15th every year. So anybody can enroll during that time, whether they have a special enrollment period or not. There are two parts to open enrollment. So November 1st through December 15th is the first half for coverage to begin January 1st. And then December 16 through January 15, those plans have a February 1st effective date. And then the special enrollment period that you're discussing, I'll let Omira go ahead and touch on that a little bit.
So for the special enrollment period, it's something that you'd have to qualify for. So this is a 60-day window that allows you to enroll in a health plan anytime during the year if you've missed your, you know, the open enrollment. So you would have to qualify for a qualifying life event. Common events do include losing existing coverage from an employer, moving, having a baby, adopting, or even aging off of your parents' policy.
Got it. Yeah. Good to know. And obviously helps you throughout the year. Not panic if you are having a baby that does qualify as life changing. And that is something that, you know, obviously I've taken advantage of throughout the year too. And these ladies are great because I I know Miranda. I always like to wait till the last minute. I would suggest not doing that. Even I was supposed to meet with Miranda next week, and she's like, "How about we push this up so we're not waiting to the last minute?"
Yeah.
So don't wait till the last minute like me. I know we're all busy, but prioritize calling in and talking through it. And I can't say that enough. That's what I did last year with Miranda, and we were in a completely wrong plan with a previous insurer, and you helped me find the best plan for my family and the coverage that we needed. And I'm just someone that needs help walking through this. This is all very hard for the layman to understand. And so so I guess I can talk all day long about why priority health, but would love to hear from you guys, you know, your selling points on why priority health.
Yeah, why not? I guess, you know, we're right here in your community. We're a Michigan-based company. Again, we're your neighbors. You know, so being with Priority Health, it does come with many benefits. Over 89% of members stay with the My Priority year after year. We pride ourselves on providing an effortless customer service experience. And we recently actually were awarded the America's Best Customer Service by Newsweek. So that's great. One standout feature is that you don't need referrals, like you had mentioned earlier. We do not require referrals for specialty care. The only exception to that rule would be the University of Michigan in Ann Arbor. We do require referrals for specialty care there. But this means that you can access the care that you want when you want it. So no waiting. Again, we all have those busy schedules. Our Priority Health member portal does make it easy to access virtual care, which we've mentioned several times. I think people forget about it sometimes, but you can get virtual care from home, including on-demand urgent care and mental health services. When choosing a health plan, make sure you're considering the overall value of the carrier that you're going with and the plan. Premiums are just one part of that cost. Be sure to understand your deductibles, co-pays, the maximum out-of-pocket costs, and the customer service as well. At Priority Health, we do provide real value, and here we help answer any questions that you may have.
Yeah, again, I have seen it firsthand and use it quite often. So and I know I just touted reaching out to you guys sooner rather than later. So can you tell everyone a little bit about how they can reach you directly, via phone, any other ways?
That's definitely important. So to learn more or to enroll at Priority Health, you do have a couple options. You can call us directly at 833-420-0879 to speak with an expert enrollment specialist like myself or Miranda, who will guide you through the process and help you find the best plan for your family. The enrollment process takes about 15 minutes, so not that long. And alternatively, you can visit our website at www.priorityhealth.com. You can get a quote or enroll online.
Yeah, and I also love the fact that, I know you mentioned it earlier, the Find My Doctor. Anecdotally, like as a mom, it was very important to me to know, is my pediatrician in coverage? Is my OB in coverage? Is, all of these things, and that's important to us. My primary wasn't, but then you helped me find one that was, and that was seamless. So, making that process easier too, because that is part of the transfer. If you're coming from a different insurance, as I was, it definitely helped me understand, like, hey, yeah, it put me to ease of like, yes, our pediatrician is covered, this is covered, that's covered, this is not, but let's do it right now and get you signed up. So again, I can't say enough about you guys and Priority Health and the care that myself and my family has received. But I'll give you the floor to close it out. Any last thoughts you want to share with us?
Yeah, absolutely. So Omira and I have actually been working together for several years on the same team as we've moved through Priority Health, but we're both very proud to work here at Priority Health. The mission of the company is something we both value: to improve health, instill humanity, and inspire hope. And you can feel that when you work with any of our enrollment specialists. I know for myself and Omira, we would definitely recommend Priority Health to our parents, grandparents, friends, really anybody here in our community who we meet, because we know for a fact that they will just be treated well here.
Yeah, love that. Well, thank you again for your time and expertise today. Again, this is a lot. Insurance is one of those it's hard to navigate, and I am not above admitting that. I have need that help, and it helps me feel so much more confident knowing that I can reach out and contact you guys or your other representatives to help me through any questions that, again, literally this morning our dermatologist said, you need a referral. I was like, I will check, and I can get that answer right away. But again, another huge sales point. No referral needed. Love that.
Yeah.
So anyways, I'm so grateful for your time. Hope everyone has the opportunity to go check out Priority Health. And remember that looming deadline of January 15th, 2025. Thank you. Of
Thanks for having us again,
Thank
Kerry.
you, Kerry.
course.
Bye.
Bye.
Okay, we can actually stop recording now then.